get this to work. And I had the pleasure of being here yesterday and hearing the conversation. And I'm delighted to have the chance to kick us off today. What I'm going to do is get more under the hood of measuring, which is especially important when we've got some complex latent constructs that we're trying to get at. And I know from getting ready for today and talking to the committee that there's a particular focus on quality and health and related to the ACA, but as some of you may know, there's also recent policy developments that have accelerated a trend toward thinking about quality to promote school readiness and readiness gaps. So we have quality rating and improvement systems that have emerged in the 1990s and are now operating in about 3/4 of the states. The Race to the Top Early Learning Challenge accelerated this trend, and the Head Start School Readiness Act in 2007. It's jumping forward without me doing it. Is it supposed to be doing that? Okay. The Head Start Act also required programs that scored low on quality to recompete for funding. This has led to the topic that I want to talk about, which is adopting measures designed for other purposes for high stakes uses. And I've got some bullets here from the Race to the Top and Head Start regulations. I'm not going to read them, but I bulleted a couple of things in here. One at the end is that are both focused on academic school readiness, so children's progress toward learning, development, and kindergarten readiness, and linking to positive child development and later achievement. And I also bolded early in here the focus on valid and reliable in connection to measures of the overall environment and teacher-child interactions, and these were to be done by observation. And what I want to talk about is that these adjectives, reliable and valid, sometimes get attached to measures as though they're static properties for all time, all purposes, and all populations. We sometimes come to see them as a stylized fact. Either a measure is valid and reliable or not. At the end of yesterday in the first breakout, we heard that group talk about copyright issues as well. And sometimes when the measure becomes part of a profit-making company, we can see this in the marketing materials where there's a shift toward really having that stamp of approval of reliable and valid. And this isn't consistent with our contemporary thinking about measurement. Instead, the latest standards suggest that we have to think about the intents of each research and policy use. We want to weigh the body of reliability and validity evidence against each use, build in continuous and local validation of measures selected for various uses, and allow for measure refinement over time and place. So for instance, we might think differently about the body of evidence if we want to demonstrate reliability and validity for program self-assessment versus for teacher professional development versus for policy decision-making and accountability. So for instance, we would want really high inter-rater reliability when we're using specific cutoffs like we are in the early childhood quality arena, but reliability could be lower for self-assessment or professional development. When raters can discuss with the teachers why they gave a score, the teacher might tell them more about what was happening in the classroom, and they could come to an agreement, a shared understanding about the score level. When we've got high stakes decisions around specific cutoffs, we also want the measure targeted with great precision around that cutoff. We want to be really sure if the program is above or below that cutoff, and when our goal, like I showed you, is for raising readiness and reducing readiness gaps, we want to be sure that our quality measures are specifically aligned with that purpose. So I'm going to use two measures as an example to talk some more about this. These are the most commonly used measures of quality. This is a graph of what the quality rating and improvement systems across the states have been using. And I won't dig into the details there, but about 9 out of 10 of the states are using one of two measures, either the ECERS, which is the Early Childhood Environment Rating Scale, or the CLASS, the Classroom Assessment Scoring System. And Head Start regulations uses the CLASS as well. These are somewhat different measures from what we were talking about yesterday. They're intensive observational measures. Independent observers come in for an extended period of time, at least several hours, to observe and rate the classroom. But the broad issues that I'm talking about apply in other contexts, such as the measures we have in surveys from parent-teacher and youth self-report. So I'm going to talk a little bit about what we know and what we need to know in terms of the evidence for high-stakes uses. And I'm going to skip over my preview in the interest of time and dig right into the details. One thing that would be very important to us is thinking about how these measures are related to the outcomes of children's readiness. And what we've seen, in fact, is increasing consensus that those associations are small, and much smaller than we thought earlier. Early interpretations and what probably led to their embeddedness in research and policy in the way they are now, and the stylized nature of our understanding of them about as reliable and valid, came out of earlier evidence that often focused on statistical significance rather than substantive size of associations, often didn't rigorously adjust for selection or confounds, and may have been better targeted at measures of quality several decades ago prior to contemporary licensing and programmatic standards. The emergency consensus now is that the associations with readiness are not always significant, generally small, often 0.1 or smaller in effect size. So the question then is why? And I'm going to talk a little bit about the limitations of the quality measures and make the point that how they were designed, their origins may relate to their limitations for their current high-stakes use. So the origins of the ECERS emerged in the 1970s from a checklist to help practitioners improve the quality of their settings. So for self-improvement, it reflects developmentally appropriate practice, including a predominance of child-initiated activities selected from a wide array of options, and a whole child approach that integrated physical, emotional, social, and cognitive components. And these may be very valid philosophical perspectives, but they may not focus on the kinds of intentional teaching that we increasingly have evidence is probably best for school readiness. The checklist practice and philosophical origins, we also see that in the way the scale is organized and how the scores are put into place. There's a bunch of indicators, 400 indicators in this original checklist. So the scale developers grouped them into 43 items in a way that made sense for practice, around context of practice. And to reduce burden, they had a stop scoring in place where indicators of lower scores had to be met before higher scores were given. And I'm going to show you a concrete example to let you know what that looks like. So these are 3 to 5 indicators under the odd numbered scores of an item. And what's important here is that we see the origins that I mentioned earlier. There are aspects of nutrition and sanitation for this meals and snacks items, a context of practice, meals and snacks. And up at the higher levels, we've got the social atmosphere, staff sitting with children, and the degree of conversation between children and staff. So you can see that it's mixing different aspects of quality. And what we confirmed with item response theory approaches is what centers and programs knew on the ground, that the sanitation indicators, which have hand washing embedded in them, every teacher and child washing their hands, these are very high hurdles to overcome. And importantly, when they're not overcome, the program doesn't get credit for the other things at the higher level, like staff sitting with children and conversation, that we might want to be sure programs are getting credit for if we're linking to readiness. And the high-stakes use has an incentive for scale developers and companies to change and improve the measures. So the scale developers are planning to release an ECERS-R this fall. From what we've seen so far, it looks like they're moving toward this alignment with academic readiness, but it's not clear how much of the ECERS-R structure is retained, and it's written into policy and embedded in existing evaluations and studies. So we want to keep thinking about reliability and validity for these current high-stakes uses. Okay, and then just a little bit about the class, because it's very different. It's not a checklist origin. It grew out of theory and research, again, focused especially on this intentional teaching, which is the bottom portion here, the instructional support piece. A fewer number of items, just 10 items. Its predecessor was a part of a research study when it was being developed, and then it was used for professional development and coaching before being adopted in high-stakes policy contexts. It's very different from the checklist. It's highly inferential. The observer assimilates what they see in order to assign scores, and the manual suggests it should never be scored without you should never score without the manual there because of the inferential nature. So the points of interest to us when we think about high-stakes use is as I mentioned earlier, we would want very high agreement if we're using specific cutoffs in policy. There's actually little information about reliability in live observations, and the reliability information in the marketing materials is for within 1. So a 3 or a 5 is equivalent to a 4. Recent publication tells us that in training of over 2,000 Head Start staff, in fact, there was just 41% overall exact agreement. And importantly, Black and Latino raters and those with different philosophical perspectives scored farther from the master. And we also want to think about how well we're actually operationalizing those theoretical constructs we talked about earlier. So we're seeing from the class developers a new bifactor structure that our team has also been replicating. So it may be not aligned as well with the academic readiness intentional teaching. We may not have operationalized it well enough yet. And finally, I mentioned earlier that when we've got cutoffs, we might want extreme precision around the cutoffs, lots of items right around that cutoff, so we know precisely if a program is above or below. In general, we want to be sure the items are aligned with our use. And the cutoffs followed the measure's development rather than vice versa. And what we see, this is Head Start data, but we see similar things in other data, is that in fact each of the 10 items, the scores are very concentrated in just a couple of the scale categories. And many of us are concerned that instructional support, which may be particularly aligned with school readiness, is low. It's in the 1 to 2s here. But again, it hasn't been well targeted at contemporary classrooms, and what we fail to pick up is variation when teachers may be progressing from low to mid quality. We'd like to be able to capture that if we're trying to invest in their moving upward, and the lack of variation likely contributes to the low associations we see with children's outcomes. And this is important to us because public investments in early childhood won't continue if we're seeing in our measure that quality doesn't really matter for kids' cognitive outcomes. Okay, so stepping back to where I started in terms of what is reliable and valid, I'm hoping to share some takeaways that we don't want to view measures as reliable and valid statically, and that we want to build in independent collection of information about reliability and validity, especially locally, in a more continuous improvement kind of way. And I'll just share with you that we're doing some of this work right now in a pilot study at our institute, where we're using new technology to gather video in classrooms. And my colleagues at Vanderbilt University are looking at an innovative measure that they've developed. It's a terrific partnership with the Nashville schools. They're in what they're calling pre-K hubs and trying to give continuous feedback and learn from teachers about how well their measures are doing. So in general, we don't want to throw the baby out with the bathwater. Quality is the right goal, but we want to be sure we've got the tools aligned with our current high-stakes policy use.